Okay. So hand hygiene, clean gloves. I'm gonna go ahead and remove the old bandage, the old dressing, exposing the wound, making sure to hide the dressing from the patient. I'm gonna go ahead and inspect the color and integrity of the wound. I'm looking for edema, exudate, and loss of skin integrity. And I'm gonna observe the skin around any drainage devices. If they're present, I'm gonna assess for odor and gently palpate the edges to assess for drainage or bogginess. And then I'm gonna measure the length, width, and depth of the wound. Two inches by 2 inches. Now I'm gonna dispose of my gloves, do hand hygiene, and create a sterile field. Please don't move. Oh. Prior to cleaning the wound, I will have administered pain meds for comfort. Then I'm gonna go ahead and cleanse the wound. Does it feel wet?
Yeah.
For deeper wounds, I would assess for depth and tunneling as well. And then I'm gonna let that dry. And then I'm gonna take sterile gauze. I should have had that open already. I'll get it wet with some sterile saline and then squeeze the excess and place it over the wound. If the wound was deeper, I would have tucked the gauze into the wound, making sure that it's getting into any tunneling. And I would also go ahead and make sure that it's flush with the skin, not packed too tightly. And then I'll cover with an EVD pad or another gauze and go ahead and tape down the corners. And then I'm going to initial it with the date. Oop. My initials and the time. 9 a.m. Ta-da! Okay, pause. Okay, so for the central line dressing, I'm gonna go ahead and remove the original dressing, perform hand hygiene, get my central line dressing change tray, pull out the contents. Put my mask on. Use sterile technique. Sterile technique. Make sure I have all my supplies. Okay. Okay, stop. Okay, and then I'm gonna scrub the area all around. If I have like a chlorhexidine, I'm gonna scrub back and forth, but if I had an alcohol swab, I would scrub in a circle. Then I'll scrub here. I'm gonna scrub the hubs of the central line too. I'll go ahead and wait for it to dry. Then I'll go ahead and apply my dressing. Apply the Tegaderm. Making sure that the port is in the window. Gonna secure the extra tubing, extra line up here, avoiding my Tegaderm. Oops, whatever, it's okay. Do better next time. And then I'm gonna go ahead and date it with the time and date and my initials.